If you have golfer's elbow, that annoying, painful condition on the inside of your elbow, and you're looking for a great way to apply some Kinesio tape all by yourself to help eliminate some of that discomfort and theoretically expedite the recovery process, then stick around and watch this video. And as a bonus, I'm going to show you a really cool, lesser known, but very safe way to make sure that that tape sticks on your skin until you're ready for it to come off. So let's get to it. Hey everyone, it's Jim here. All right, let's get right to the topic on how we can apply Kinesio tape to the inside of the elbow here to help with some of that pain and discomfort that comes along with this annoying condition. Now, today's video is all about how to do this yourself, but before we get right into it, I need to run through a couple of things with you first. So the first thing here is that if you do have golfer's elbow, or you think you have it, or you just got some pain and discomfort around and through there, get it examined and checked out by a qualified professional to do so. Now, I'm a physical therapist, but I don't know anything about you, and I'm certainly not your physical therapist. So I can't tell you what's going on with your pain or discomfort, so you need to find someone who can evaluate it for you. Now, that leads me into the second point here, in that when we're treating golfer's elbow, or this annoying kind of painful condition involving some of the tendons on the inside of the forearm, we need to remember that Kinesio tape, or this kind of stretchy, kind of elastic tape that we use, it's a great adjunct to help with discomfort and theoretically increase the rate of recovery, but it's just an adjunct, meaning it is just the icing on the cake, that little cherry on top for doing all that we can to get rid of the condition. Other treatment is going to be really important as well, and while I won't go into it in this video, just keep that in mind. Now, the third thing that I need to address with you here is that when it comes to taping, there is more than one way to do this. Whether it's for this part of the arm that we're applying the tape to or anywhere else on the body, using Kinesio tape is really half science and half art. And so what I mean by that is that we need to abide by physiological principles and kind of anatomical structures that we're trying to tape over and tape for, but there's no one right way to do this. So the way that I'm showing you for today, it's not the right way, it's not the wrong way, it is a way. And I've done it this way in this video specifically because I'm imagining that you're going to be doing this yourself. So there's more than one way to do it, but when you're doing it by yourself, it's definitely kind of a different ballgame. But the steps I'm going to walk you through are going to have you covered, so don't worry about any of that. So as I dive into this video, keep in mind that it doesn't really matter what brand of tape you use. You can use whatever works best for you, whichever one you like. In today's video, I had some Rocktape sitting around, so I wound up using that. But whether you use the actual Kinesio tape or KT tape or T-Max or whatever it's going to be, doesn't matter. Just find something that works for you. All right, now I'm going to get right into the steps here, and I'm going to talk about some other cool things along the way. So with that being said, let's get right to it. Now, with that being said, the first thing you want to do is you want to just get some K tape. Now, today I'm using Rocktape. I had a roll of Rocktape just kind of sitting around, so that's what we're using. But any brand of K-tape, whatever is going to work for you. I think in one of the other videos where we did lateral epicondylitis or tennis elbow, I wound up using T-Max tape. Just find a brand that works for you. So once you find that brand, whatever tape it is, you want to cut off about 2 strips of tape that are about 8 inches in length each, and then round off the corners. Rounding the corners just helps to make sure the tape is going to stick on the skin a bit better. And so once you have that, you're just about ready to go. Now the next thing that we want to do is we want to know exactly where we're going to be taping here. And so with golfer's elbow, we often get right where I've put a marker here, just soreness in that general area. It's a little bit different for everyone, but somewhere right around in through there. So this is for demonstration purposes to help you see where I'm going to kind of line up the tape that I'm using here. And keep in mind that there's more than one way to do this type of taping technique. Taping really is half science and half art. And we want to be mindful of the fact that if you're doing this by yourself, you'll probably have to modify the technique a little bit because it's kind of tricky to do by yourself. All right, but with that all out of the way, let's kind of get into it. So what we're going to do here is we're going to take our first strip of tape and we're going to think about trying to put it down in a way that's going to cross over that sore spot. And then we want that other piece of tape to cross over the sore spot as well. So the tape is crossing right over that epicenter of that pain. So theoretically, we're getting as much kind of skin and tissue lifting away from there as possible. And so as we do that, we want to think about putting the arm into a position that's going to have the skin stretched out as much as possible, provided that it's comfortable for you. So what I'm going to do for this video is I'm going to make sure my arm is as straight as I can, comfortably, and then I'm going to kind of pull my palm back a little bit and then just see if I can hold that position when I actually start stretching out the tape. So what I'm going to do here, I'm going to take the tape, I'm going to fold it like a taco, and then I'm just going to kind of peel it down so I get that first little strip taken care of. Now from there, what I'm going to do, I just kind of fold that back over. I want to make sure that I'm laying down the tape in a way that's going to cross over that spot there. And I don't want to be on the back of the elbow because that just, it might not feel comfortable, and the skin just wind up kind of might, what am I trying to say? The skin might cause the tape to lift a little bit. But so I'm going to start kind of right about here. And then the first thing I do is I just want to make sure that I place that end of the tape down without any stretch on it. Okay, that just helps minimize skin irritation, and it'd be hard to stretch the end anyways if you're doing this yourself. But now I've angled it in a way where it should cross over that sore spot, and so now I'm going to peel off the tape a little bit. Now I'm going to pull till the tape is about half stretched out, and then I'm just going to kind of make sure that the tape goes down onto the skin, right in through there, and then I'm going to repeat. So I'm going to pull off another couple inches of tape, give it about half or 50% stretch, lay it right over that sore spot. And I'm starting to see I'm going to get a little bit of a wrinkle, so I'm just going to adjust that a little bit. Now, tiny little wrinkles are not a big deal, but you don't want major ones. And this is where, again, it gets a little bit challenging to do by yourself, so it'll take a little bit of practice. But I've got it on there. Now I can give about a good 50% stretch there. And then I'm going to lay that down to stretch. I'm going to make sure it's on. And then that last little bit there, I'm just going to lay that on without any stretch. Now I take a second just to make sure that that tape is really on there. That feels pretty good. And we can already see, hopefully, that that tape is starting to lift off the skin a little bit. So the skin's getting a little bit wrinkly when I bend my elbow, and that's exactly what I want. So we're going to double up on this now. And now I'm going to fold this other piece of tape, just like a taco there, so it peels right off. Fold over that back end. And again, now I'm going to angle it a little bit more down in through here. And again, we're going to kind of make an X. Again, the sore spot was right about there, so we're going to try and cross over the tape there. So I've got that put on, should stick pretty good. Peel a few inches, really kind of give a 50% stretch. Oh, and I should probably straighten my arm out just a touch more. And again, just making sure that as I do this, I do it in little increments so that the tape stays stretched and I'm not getting any wrinkles into the system. Big pull from the tape there, laying it on down. And now we got just a little bit more to go. And again, so what we're doing here, if you want a little bit of the science behind it, is that we're using the tape to kind of distract the brain from a little bit of pain and discomfort. We are decreasing what we call nociception to the brain. And so the brain kind of gets distracted by the sensation of the tape on the skin. And then so the brain focuses on that a little bit rather than the pain coming from the sore tendons underneath. So that's one nice little benefit from the tape. And then we're theoretically lifting the tissues, kind of like sandwich layers all being lifted apart a little bit, again, to provide some better fluid dynamics beneath, to help with a little bit of a ideal environment for those sore tendons to get a little bit of reprieve. Now that's on there just like that. So there's my little X, and again, you can see the skin bunching up nicely. So we quite like that. Hopefully you can see that there. But what we're gonna do now is if you feel like this is gonna stick on just fine, perfect. But I got a little tip just in case that maybe you're going to be doing some sporting activities or you feel that the tape's not going to stick down as well, and you want to get a little bit of an extra kind of stick with this tape. There's a great thing that you can do here. And so what I've done is I took a product called Cover Roll, also sometimes called Hypofix. It's a very hypoallergenic cloth tape. And what I've done is I've just cut off a couple of strips, and I've rounded off the corners of these as well. And with this hypoallergenic cloth tape, I'm just going to peel off a couple of these little strips, and I'm going to put half of it down so that half goes over the tape and then the other half goes on the skin. And what that's going to do is that's going to be a nice reassurance that the tape is going to stick down, either if you have a lot of hair that you didn't necessarily want to trim down or shave down, or if you're maybe going to go do some sporting activities or you think you're going to get really sweaty. This can be a nice little bit of extra insurance to keep the tape on there. So not necessary by any means, but a lot of times I'll do that with my patients in the clinic when they are maybe heading off to a sporting event after, they just think that they're going to need a little bit of extra reassurance. So we'll put the last two on and we'll show you what it looks like. And again, hopefully this will help start to decrease some of the pain and discomfort a little bit and give some better fluid dynamics underneath the skin. So there's that one there. And I just got one more that I can do right up and through there. So keep in mind, there's more than one way to do this type of taping. And when I say that taping is half science and half art, I really mean that. So just find something that works for you. Make sure it feels appropriate. And if the tape is staying on good, you can keep it on for a couple of days, provided that you're not having any reactions to it. And then just pat it dry in the shower, provided that, again, your skin's not becoming irritated. If you're finding your skin's getting irritated, you just take the tape off. You can heal just fine without it, but this is just a nice little adjunct we want to use as long as your skin can not become irritated. So that's what it looks like there. It feels really nice. Nice little distraction for my brain for sure. Hopefully you can see it start to kind of crease up the skin there, and that's exactly what we want. So there you have it, a step-by-step approach of how you can apply some Kinesio tape to the inside of your elbow for that annoying, painful golfer's elbow condition. Now, if you found this video helpful and informative in any way, please just hit the like and subscribe button. That just helps me to grow the channel and helps me to ensure that I can keep getting content out there, not only to you, but to other individuals who could possibly benefit from it. As well, if you have any questions about what I've gone over in this video, or you have other ways that you like to apply K-tape, whether it's for the inside of the elbow or other parts of the body, I want to hear all about it, so leave it in the comment section below, and I'll do all that I can to respond to you in a timely manner. So that's it for the video. Everyone, take good care of yourselves. I hope you're staying safe. I hope you're staying well. Keep looking after yourself, keep making good things happen, and I'll see you in the next video.